Yeah, so I'll go ahead and introduce our presenter today, Aparna Gopalan. Aparna is a third-year doctoral candidate in social anthropology at Harvard. Her dissertation research focuses on corporate-funded poverty alleviation projects in rural Western India, situating them as part of a broader phenomenon of privatized development efforts across the global South. Both through research and through public writing and teaching, Aparna's work aims to open the field of development in particular and economics in general to the wider democratic debate and public scrutiny necessary in a time of stark inequality. So with that, I'll turn it over to Aparna.
Thank you so much, Lisa. And I would really want to thank all the organizers for putting this together. I think it's a really important opportunity we have to kind of talk about this, all these issues. I'm going to go ahead and share my screen. So just give me a second. Okay, so I hope that my screen is visible to you all. So this talk is, as you know, it's titled A Pandemic of Commodification, COVID-19 Profit and Public Goods and Comparative View. And the idea for this talk came from observing media and public conversations about COVID-19, both in India and the US simultaneously, both places that I am part of and pay attention to. In both cases, what was really interesting to me was not the specific facts that were part of the media conversations, but the entire problem, the entire framing of the problem of COVID-19, particularly as it comes to the economy. So there's an ongoing debate, as many of us know, about public health versus the economy, and there's these different positions that people seem to be taking. One position is that public health is something which is basically right now constraining our freedom, whereas the economy is something which will liberate us and enhance our freedom. And a dissenting view holds that we actually need to just put a pause on the economy for now and focus on maintaining people's health by either extending lockdowns or quarantines for as long as necessary. In both cases, what's curious is the way that the whole conversation is framed as economy versus health. And I want to explore in this talk if that's really the right way to formulate the question and what other ways we have of understanding the pandemic, and if there's places in the world which can offer us ways out of these binaries. So this talk is part of my effort to kind of open up the black box of the economic questions surrounding the pandemic and to talk about social and economic factors which would go into building a humane response, along with rethinking the relationship between the economy and our health. So with that, I'll get started. So the overall plan for the talk is as follows. First, I'll introduce you all to South Asia. This is not a very extensive introduction because we don't really have that much time, but I'm just gonna make sure that everybody's familiar with the geography and economics of the places that I'm gonna be talking about, which is broadly the country of India and a state within that country called Kerala. After a brief introduction to these things, I'm gonna talk about India and Kerala's COVID-19 responses, which are very different from each other, and just put them side by side. During this time, I'll take questions, so I'll be happy to hear from you if there's any facts or data that I can clarify at that point. After that is the kind of key portion of the talk where I'm going to try to explain why there is this difference between these two places, and do that by putting these big concepts to work, like commodification, austerity, neoliberalism, planning, public goods, democracy, the economy, all these kind of four-syllable words, which we really need to know what they mean and need to be able to grasp them. After that, I'm going to go into what are the takeaways which we can get from this comparison, which we can use to understand and hopefully change other places. Because that's really the point. This is not a lesson in regional history. It's more of an exercise in trying to understand what can we learn from this comparison. And finally, I'll take questions in the end again. So please hold on to those questions. I'm happy to hear them. With that, I'll get started. So beginning talk about India. India is the 7th largest country in the world, and it's the 2nd most populous country in the world. So this map depicts the relative size of India in terms of population. So if all countries were sized by their population, this is how big of a part of the world India is. I think that's important to know in terms of how relevant India's response is to what's happening in the world. Um, in terms of GDP, India is the 5th richest country in the world. And there is, in fact, a narrative around India, which is about India that's growing and booming, which has taken over the global media, especially since the 1990s, when the Indian government undertook a series of economic reforms, which were aimed at making production easier and cheaper for big and multinational businesses. This image shows some of those reforms in a pictorial representation. We don't really need to go into the details. This person in this image right here is the richest man in India and one of the richest people in the world. And these are the kinds of people who are at the helm of this booming economy. India's growth has also been the subject of a flurry of academic books, popular books, news articles, of just a rising, emerging, shining, unbound India. Even characters in Bollywood movies have gone along with this. You can see this representation from a movie from the 70s. And the same actor represented in a movie from the early 2000s. So he's really scaled up. All this isn't to say that India has just experienced this kind of upward trajectory, because alongside this glittering India, there's another story. Which comes to mind when you realize that even though this is the 5th largest economy in the world, its per capita income, how much each person has, is not as high. The wealth per adult in India, as this map is showing, is somewhere around between $5,000 and $10,000 a year. So this is kind of the perspective that brings us back to images like these, and the fact that India ranks 129th in terms of the Human Development Index, which the UN releases, which measures life expectancy and education. India ranks worse than El Salvador and Botswana. This is the India of slums, of poverty, child labor, infant mortality. This is the India that is seen as being in need of development aid and of sympathy. To reconcile these two narratives, often what is used is a theory of overpopulation or a theory of underdevelopment. But what we really need to reconcile these two stories is a theory of inequality. Much like the United States, but worse than the United States, India is a plutocracy, where the richest 1% hold more than half the country's wealth, and the poorest 60% hold barely any. Here's another way that that can be represented. So if this is the landmass of India, 50% of the people, half the population, would hold just this bottom tip. So this is what we need to kind of keep in mind as we talk about India and COVID-19. Moving on to Kerala, which is the 2nd place. So Kerala is actually a state within India. It's the southwestern state, which is shown here in this image, which covers just 1% of the country's landmass and houses just 3% of the population. It's not a very, very large state, as you can see. It's also neither the richest nor the poorest state in India in terms of total GDP. It ranks somewhere in the middle. So we can see here that the darkest blues are the richer states, and the lighter ones are poorer, and Kerala is somewhere just in the middle, ranking similar to the way that India ranks in the world in terms of its per capita income. And yet for decades, this state has been exceptional in India because of its disproportionately high development indicators. In the Human Development Index, which I just mentioned, which measures life expectancy and education, the state of Kerala has consistently ranked number 1 in India. As we can see in this list, it outranks not just other states of India, but actually India as a whole by quite a lot. Another way to see how much of an exception this place is to look at this map of India and see it represents Human Development Index by color, and the darkest color is the highest HDI, and Kerala is a very dark green here. In fact, the state is a place where the average person has a higher life expectancy than Black men do in the US, educational achievement comparable to China, infant mortality comparable to Korea, and a female to male ratio comparable to Western Europe. And all this is happening while this place has a GDP, which, if it were a country, would place it among the 50 poorest countries in the world. Even in terms of sustainable development, which measures human development plus carbon emissions, Kerala ranks very highly. It ranks 13th in the whole world. India ranks 56th, and the United States ranks 160th. So this phenomenon called the Kerala miracle has been widely noted and studied and critiqued since the 1970s. There has been a lot of talk about how we can explain this, and I think those questions come back into focus when we look at the way that Kerala responded to COVID-19. So before that, let's look at India's response to COVID-19, which has been very interesting. It's been what I would, as a social scientist, term a fiasco. As late March, members of India's ruling Hindu Right Coalition were touting the benefits of cow urine as a sanitizer and tonic against COVID-19, while Indian scientists and epidemiologists associated with the government were resolutely denying that the pandemic would hit India, that it would spread in India, using explanations like India's tropical climate or Indians' unique genetic immunity to deny the incidence of community transmission. This has been happening as late as May 4th, so this is not some gone by story. Meanwhile, the Prime Minister announced a 14-hour lockdown in India as of March 23rd, at the end of which he asked the public to come out onto the streets or come out onto their balconies and bang their pots and pans, and utensils to scare away the virus and to thank essential workers. So this is an image which shows people doing that. This resulted in a day of curfew followed by a night of plate banging parades. That day would have been better spent preparing for the upcoming lockdown of 2 months and counting. But the Prime Minister did not announce that drastic measure until 2 days later, giving 1.3 billion people 4 hours warning to shut down their whole lives. So he came on television and made the announcement at 8 p.m. And as of midnight, people had to stop going out. And this was no shelter in place order. This was a military style operation where everything was shut down. Transportation was shut down. Police were deployed. If people were found in the streets, they were beaten up. Even grocery and medical stores were shuttered in some areas. And this would be bad enough in any place, but in a country where 80% of the population earns their daily meals daily, this became a humanitarian crisis. As work closed and daily wagers lost the ability to house and feed themselves in cities, there was a mass migration from cities into the countryside. And this happened largely on foot because all other transportation was closed. People walked hundreds of miles, sometimes with infants, sometimes with disabled relatives, elderly parents, with almost no food or water and carrying all their belongings. Meanwhile, there was no relief package announced for these millions walking. The government's relief was mostly releasing big numbers, which were basically existing government spending, which was already going to happen this year. And very little in way of direct resource transfers to the poor, with the exception of grain. Incidents of starvation began appearing in the media alongside pictures of overflowing granaries. India's substantive railways can carry some 23 million people in one day, but they lay closed, as did buses. Meanwhile, migrants were stranded away from their families, and we were seeing these horror stories in the media, like this person who in this picture is crying because he has just received news that he has lost his 1-year-old son who's in a different area, and he's not able to go see him, bury him, because the police won't let him through. Another disturbing story has been when these 16th migrant workers were walking along train tracks to get back home because they were told that trains are not running. And they spent a night exhausted sleeping on the train tracks, and the next day a goods train ran them over and killed them. So this is clearly showing us, between goods and human lives, what was prioritized in the lockdown. And recently trains have opened, but this has only added to the disaster stories, as passengers have died of hunger and thirst, on the extremely delayed train routes. Just today, there have been stories. There's been a very disturbing video of a dead mother laying at a railway station while her infant tries to wake her. And these kinds of stories are not exceptions, and they're not single individuals. This has been a systemic pattern of how migrant laborers and laborers in general have faced the lockdown. And meanwhile, you'll note that I've not really spoken very much about public health so far, because India has taken this health crisis and turned it into a humanitarian crisis. But the health crisis is still there, and it has grown steadily worse. This graph shows how the curve is very far from being flattened in India. This has been because testing is scarce. It remains offered at cost. Rumors and fears are all over the place about reporting one's illness. People are afraid if they tell the state that they're sick, they're going to be arrested. And under testing aside, we can't even know how many people have the disease, because even death numbers cannot tell us. In India, in normal times, only 22% of all registered deaths are medically certified. So today we can't even know if people are dying of COVID-19 or of something else. Meanwhile, hospitals have quickly become overwhelmed, ran out of beds, ventilators, and especially doctors, who are increasingly told to report to work even if they do have COVID-19, because there is no reserve. State quarantine facilities and hospitals are more likely to make the healthy sick rather than the sick healthy. This account of a television producer shows us the kind of picture of the unhygienic, unsanitary situation. You can see that this person is a television producer coming from Thailand and going to a government hospital, and only imagine how much worse the situation would be for somebody who doesn't have her social capital and money. So this has been a brief sketch, I guess, of India's response. If there's any questions just about these details or about the overall introduction, I would love to hear them. Lisa?
Yeah, right now I don't see any questions in the chat or the Q&A function. People should feel free to just type whatever's on your mind into either the chat or the Q&A, which will be at the bottom of your screen. But right now, I think there are no questions.
Great. And feel free to type the questions now, and I'll pause again after I discuss Kerala's response, and I'm happy to answer questions then. And I'll also stop the questions at the end. Okay. So jumping into what has been an alternative response. So Kerala's COVID-19 response has been quite different. This is the way that it's been depicted in the media. This is an interview that was published in The Guardian. She's been dubbed the coronavirus slayer. She's been dubbed a rock star. But just in simple terms, what happened and what did she do? This is the Health Minister of Kerala, K.K. Shailaja. On January 17th, K.K. Shailaja phoned her state health secretary because she had read online about a dangerous new virus spreading in Wuhan, China. I'll just pause and repeat here. January 17th, 2020. She asked her health secretary, will this virus come to us? And he said, definitely. And so they started preparing. And preparations were basically centered around the fact that they knew that there was a lot of students from Kerala who studied medicine in Wuhan, and they were going to bring the virus back. And she said, just like we calculated, the first returnee from Wuhan came on January 30th. And here's what she said in her own words. We had traced the first traveler from Wuhan before she came here. Airport authorities were asked to inform us immediately after her flight landed. And so when she landed, we sent her directly to an isolation ward set up in the hospital in her hometown. Since she had interacted with her family at the airport, they were also sent to isolation. When interviewed, she told us that 2 other students had returned from Wuhan along with her. We immediately sent a pickup team to their houses and isolated them along with their families. And then this, of course, raises the question of what is happening in this isolation ward. And this is a testimony from the student, the first student who landed in Kerala. She says, I was shifted to the government medical college on January 31st. Health Minister K.K. Shailaja visited and consoled me, and it was a great relief. When teachers started giving online classes from China, I started focusing on that. It was like a classroom as all the students were connected. The hospital set up Wi-Fi and other facilities for me. I got whatever I wanted to eat. I ate a lot of biryani. I watched many movies on the mobile phone. Um, she keeps going. She says, I have seen the way the medical staff from top to bottom operate in the hospital. Even before I was admitted, all of the staff, including the janitors, were equipped to handle the outbreak through awareness classes. A team of doctors from various departments, such as epidemiology and community health, treated me in the isolation ward. They were calm and friendly, and she even had appointed counselors in case of emotional distress. She discusses how doctors got details of every person she spoke to, screened her relatives, a local health inspector monitored them. And then she says, there seems to not be a link out of place in this complex web of public health, with every stakeholder coming together to curb the spread of the disease. And she goes on to talk about there's times when she felt depressed, but the health inspector called and comforted her and became close to her. And finally ends with saying, Kerala's public health system inspires me, seeing the level of preparedness the health personnel have and how they fearlessly tackle any adversity from Nipah, which is a virus that broke out in Kerala in 2018, to coronavirus, makes me want to become part of this inspiring system. By which she means that she wishes to come back to Kerala after her studies are completed in China to practice medicine there. This is, I think, a representation of what people know as the Kerala model or the Kerala miracle. Given the state's population density, its deep connections to the global economy, and the high international mobility of its citizens, it was primed to be a hotspot for COVID-19. And it was the beginning. It was the first state in India to be hit by the pandemic. But Kerala now is about the 10th state in the country. It has experienced just 4 deaths. It has a GDP of less than $3,000 per person, but it's a better place to live right now than the UK, with a GDP per capita of $42,000 and more than 36,000 deaths, or indeed the US with a GDP per capita of $62,000 and more than 100,000 deaths. So this is another representation. This is from a newspaper, another graphic which shows the so-called Kerala miracle. And there's lots of stuff going on here, but the key thing that I want to bring people's attention to is the comparison of the Kerala model to comparable population, countries with comparable population, such as Canada, the Netherlands, Ecuador. And you can see 503 cases versus 67,000 cases in Canada versus 42,000 cases in the Netherlands. Another interesting thing about this graphic is where it shows that there's a gap because the curve was actually completely crunched for a period, and then cases came back from outside, and then the curve was crunched again, and then cases came back from outside. So this has been a very different trajectory of the dipping curve. So what concretely went into this? What are the proximate reasons? So the first and most obvious reason is rigorous contact tracing and mass quarantine. This is what the WHO recommends. This is what successful countries all over the world have done, and this is what Kerala did. But how it was done is important. So this was all done with decentralized community outreach. What this means is that contact tracing did not involve cell phone surveillance like it did in South Korea. It was done by public cooperation participation using phone calls, ads, social media, and a huge army of contact tracers. By army, I mean volunteers and government workers. And local leaders at local health centers were responsible for monitoring quarantines, not the police, with the help of citizen participation. So that's a really key feature. Another way it was done in Kerala was under a robustly funded and coordinated healthcare system. There were already free primary health centers in each village. There were also isolation, testing, and treatment facilities, which were available free of cost. There were already pandemic drills and isolation wards, which existed from a previous 2018 outbreak, which were reinvigorated. There were already ground level healthcare workers who made field visits to assist not just with medical needs, but with grocery needs for households, special needs, elder care, mental health care, destigmatizing the disease. So this was a key, really key feature. Another way in which Kerala managed this was by embedding its response in the principles of public health, which means really banal things like providing drinking water, which is safe and clean, providing soap and water in all public places, using all state employees to spread awareness about best practices, including school teachers, including cultural workers, including the police even. Um, this was led by a science-based and very empathetic administration. The government had a rapid response team which met every single day to bring the government news of the equipment, personnel, and the size of the outbreak in different areas. There was daily briefings which released information about the status of the outbreak, and information was quickly translated in the local language. Um, the other part of there being an empathetic administration is that it helps in the community outreach. So, for example, when places of worship were closed in the state, local faith leaders were consulted and the government received their approval. The government also has released a clear plan stating the criteria by which the state will eventually reopen and the way in which it will, so the phases of reopening. And finally, all this was being done with a focus on saving lives, not on saving the state's or any private entity's profit margins. So migrant workers who were in Kerala, even from other states, were fed, they were housed at the state's expense, they were sent back in charter trains when it became possible. The state also released a comprehensive economic package before India's and released it 10 times the size of India's package, and this is a state in India. So these are the ways in which Kerala did what it did. And finally, it's just important to mention, any other state which had done all this, we would expect a lot of fanfare by the government. But the focus in Kerala remains on caution rather than on celebration. They're already preparing for a second surge because lockdown has been eased throughout India as throughout the world. And they have plans A, B, and C. The health minister says the plan C involves requisitioning beds from hotels, hostels, conference centers, and training school teachers to do contact tracing. So this is kind of the response in, I guess, not really a nutshell, but in brief. And I'll stop here again for questions. I do see that there are some.
Yep. All right, so in our Q&A, I'm just going to go in order that they appear on my screen. So Stu has a question. I know Prime Minister Modi has been leading something close to a war against Muslims. How has this affected the response to COVID-19?
That's a very important question. In fact, in India, in early January, when in Kerala, the health minister was watching news of COVID-19, the rest of us in India were watching news of riots. There was religious riots in the country's capital. There was killings of dozens of Muslims, and this was all part of a very large national crisis, I guess, which was inaugurated by PM Modi's very controversial citizenship law. So things were already really grim. And I think the COVID-19 crisis has affected minorities really badly. The news coverage in India on the television, if you watch it, is about how Muslims have spread this disease throughout India. It's an ironic twist that when the disease first started spreading and started being reported on, the highest number of cases were actually Muslims, because that's who they were testing, because that was the theory that needed to be confirmed. And this is, of course, talking about at the level of the media, but Muslims and other minorities in India remain the poorest, having the lowest access to government services, having the lowest access to well-paying jobs, healthcare, things like that. And so all those factors play into this. And I think all those inequalities shape it. So just like in the US, we see frontline workers who are people of color bearing the brunt of this disease, dying at 3 times the rate of white people. India, we don't have the data. We don't have such comprehensive data, but if we did, that's what it would say, is my guess.
So yeah, just looking at some of these other questions, I think some of them might require more in-depth response, in which case we'll leave them to the end. Another sort of more factual question from Sung Kain. What was India's preventive measures prior to its first case, if they did have any?
Prior to its first case, I don't think there were preventive measures at that point, because the first case in India I mean, the first case in India was the first case in Kerala. So I guess in that case, there were preventative measures. But India as a whole, there really wasn't a government level response in terms of prevention or anything like that until very late in March. And the first response was basically the shutdown. So before that, there wasn't, I mean, there was hand washing advisories and things like that, which were out from the Centers for Disease Control in India equivalent. But that was not something that was being pushed as a public health measure. There weren't village level workers who were walking around telling people what's happening and what they need to be doing. So there really wasn't preventive response. I think that's part of the problem.
Great. I think we'll maybe defer the rest of the questions to the end unless anyone has any factual questions they want to quickly input somewhere. Okay. Maybe we can move on with the rest of the presentation.
Sure. Yeah, and again, there's going to be a bunch of time for questions in the end, and I'm happy to stay over time if people want to talk further. But now we really kind of get into the really interesting part, which is why did this tiny state, which is so much poorer than everybody else, why did it manage? I mean, it should have really done very badly. I mean, conventional wisdom tells us that there's this fear that when COVID hits Africa, what's going to happen? And I think Kerala is, in terms of per capita income, comparable to any sub-Saharan African country. So how do we explain what happened? And it's clearly not just money. It's clearly not just development. So the first reason that comes out from reading the history of India and Kerala is these are kind of alternative binaries to the one between economy and health. So one binary that emerges is basically in Kerala, we had unions, and in India, we had profit. And what that means is that, so Kerala has a model of a very high public health and education investments, which came about because of an intensely unionized workforce. Since the early 20th century, this workforce has agitated for higher wages, labor protections, but not just that, not just typical union things. They've agitated for the state to ensure a decent standard of living for all people. Unions in Kerala are kind of exceptional in that they're powerful across the rural-urban divide. They're powerful across the formal-informal divide, male-female divide. There's unions in agriculture, in industry, in the service sector. Banking workers are part of a union. Doctors are parts of unions. Nurses are. And these unions form the base of all political parties. So to win political power in Kerala, or to even contend for political power in Kerala, especially in the late 20th century, you have to listen to the unions, and the unions force parties and force administrations to take up distributive issues first. Another key feature is that these unions agitate no matter who is in office. The agitation does not stop with the election of their party. So for example, even when left parties came to power and passed laws to redistribute resources, unions were still organizing on the ground to make sure the laws were implemented. When land distribution laws were passed in Kerala by left parties, but the laws were not implemented on the ground, activists, people who were part of the party, but people who were union members, decided to carry out a land grab movement on the ground level to force the implementation of the law. Meanwhile, in India, unions have rarely taken such an active role in lobbying the state for public goods. And moreover, they've been struck down repeatedly because the interests of big business have dominated the production and distribution of all goods. And this is true in the colonial period, after independence, and especially since the 1980s, which we'll talk about a bit more. And so this is why the pandemic today is we're basically faced with problems like highly profitable health activities like non-essential surgeries, which dominate the health sector rather than basic health for all. And there's no reliable way to resist this state of affairs because labor is not organized. So that's one thing that comes out from the history of these places. Another relevant binary that we can think about when we're comparing responses is the binary of public good versus commodity. This is a very important one. So because healthcare is a public good in Kerala, people are able to pressure the government to make sure that healthcare is delivered and it's of high quality. This is where we hear really striking stories about how visits to primary health centers, which are village level health centers in nearby states in India, reveal that doctors are frequently absent. They're just not there. And that's a norm. But if in Kerala, a primary health center is left unmanned for a few days, it is followed, or it was followed at least in the late 20th century, with a massive demonstration at the nearest government office. The demonstrations led by trade unions, village governments, and political parties. Demands begin circulating in the local press. Direct action follows afterwards if the government doesn't follow through. In a really memorable story from 1962, an anthropologist talks about how angry neighbors dragged a physician out of the cinema where he was during his shift and forced him to go to the hospital to deliver the baby of a woman who was in great pain. This kind of pressure not only allows people to maintain, but also to fight to enhance facilities. Um, and this kind of widespread sense of what is owed to the people is why Kerala has twice the number of medical staff per person than India. But in India, because healthcare remains a commodity, today's crisis is made worse because public hospitals refuse to treat COVID-19 patients in many cases. And underfunded government hospitals, which only have 30% of the market share in healthcare, are treating 90% of COVID-19 patients. And again, there's not really a way to resist the state of affairs because private hospitals are doing what they're supposed to do. They're trying to make money. That's their job. Private companies cannot be forced to provide PPEs, tests, or ventilators at production prices, at low costs. And we're actually exporting these life-saving resources until the government banned them from doing so. So that's a second kind of key binary. A third one is investment versus austerity. So public goods need regular investments, otherwise they languish. Kerala has made those investments because of public pressure over the decades. Even when the national government recently decided to enroll Kerala in a centralized health insurance scheme, which was meant to popularize public hospitals among citizens, the state's government decided instead to use the scheme to make public hospitals more inexpensive and improving their quality so that even middle-class citizens would want to go to public hospitals rather than private ones. The health minister refuses to privatize public hospitals, which the poor rely on for survival. Meanwhile, in India, funding for its government hospitals has been falling steadily since the 1960s, while private hospitals have ballooned into an expensive and unregulated and, quite frankly, a dangerous industry in many instances throughout the country. Thanks to decades of austerity, which is this kind of lack of investment and this deliberate uninvestment, the poor in India today cannot afford testing, treatment, isolation. Another part of investment versus austerity is not just to have healthcare systems, which needs to be invested in, but also to have public health. And what this means is a water supply, which is public, which is clean, effective sewage and drainage, vaccinations, things that people in the developed world don't really think about as often because these have been cemented decades ago through investments. Even when it became clear from pandemics of a century ago that cities and places which have proper water management systems don't suffer from pandemics of cholera and malaria, India's government didn't invest. Even though there's evidence that hunger breeds disease, this doesn't make malnutrition a public health priority. In contrast, Kerala has provided public taps to residents free of charge. They have invested in respiratory disease inventory so they know when it's COVID-19 versus other diseases which spread. They've created an expansive system to distribute nutritious food, etc. Now, all this is not to say that things in Kerala are really rosy. Investments have actually been declining since the 80s, and we're going to talk a little bit about why. But still, in comparison, these facts remain and this history remains something to pay attention to. Finally, another really important binary is planning versus neoliberalism. So planning is basically the process of, and it's kind of a forgotten thing, at least in the US public consciousness. But in the 1960s and beyond, there was this effort to secure long-term investments in key sectors and to coordinate between different producers in the public interest. In India, though, planning, even though it existed in name, didn't actually lead to these investments because there was never much political will to ensure that production is geared towards making what is essential, not what's profitable. Especially since the global pro-market reforms of the 80s, coordination capacity in essential production has gone down even further, such that luxury condos proliferate today in India and they grow the GDP, but the entire supply chain for tests is in disrepair. So in the absence of planning, what happens is things like garment factories today are struggling to sell what they make, even though there's a shortage of masks. But market signals cannot match supply and demand here. What's happening here is that thanks to the lockdown, migrants are starving and walking home and are in need of work, when in fact, had they been housed and fed in cities, they could have performed the essential labor of making protective equipment. And now there isn't enough labor to make protective equipment in cities. Um, Instead, Kerala has opted for decentralized planning, where local needs guide what is produced and invested in. The finance minister himself celebrates decentralized planning for, and I quote, putting extra parliamentary pressure from below on the state. This kind of planning is what is behind the fact that Kerala's healthcare system invests not in high-end, specialized, non-essential surgeries or highly specialized degree programs, but they invest in the bottom, the lowest common denominator: nurses, primary school teachers, midwives, childcare workers. Um, and this is why this is really interesting. Kerala only has slightly more doctors per person than India, but 6 times more nurses per person, reflecting the results of decentralized planning and investing in essential services. Um, so I just want to take a pause here and go into this term neoliberalism, which one hears all the time. There's many definitions which float around, from state retrenchment, market fundamentalism, austerity politics, deregulation, income inequality. Every discipline in academia has its own string of 4-syllable words, which it combines to explain what has changed since Reagan and Thatcher came to power in the Western world. I really wanted to kind of break it down in a very simple way, which makes sense. And the simplest way I found so far to capture it is this. Um, Neoliberalism is a global public-private partnership, which means the state and the market together created the system, which since the 1980s has built power and used it to do the following. First, to commodify more and more basic needs and tether all production solely to the profit motive. Um, so this is important to say because that's really what it is. People talk about deregulation. Well, yeah, there's some regulations are removed, but others are introduced. What we need to know is by what principle, and the principle has been commodification. So this has included things like defunding, things like education and healthcare, passing laws which make it more difficult to maintain levels of public funding. This has included things like deregulating, removing different regulations which mandate certain basic. So, for example, foreign direct investment was not allowed in many sectors in India, in sectors like defense or sectors which were considered to be key sectors, and now it is. So, removing those kinds of caps and making more and more things less public. So that's one thing. And the second part of it is the profit motive. So basically, it doesn't matter if stuff is necessary or not. It matters if it makes money or not. And that's what determines whether or not things are produced. And the second thing is what neoliberalism does is it directs the profits of work away from workers. So yeah, profit motive, but that itself is not really the full story. So things like union busting, things like attacking minimum wage and workplace securities, removing taxes on the rich, things like that are kind of key to it. And the third and kind of more intangible thing, but important, is to spread market metrics across all domains. And what that means is the way that success is measured, even for something like a public hospital, is by its yield, which is not the point of a public hospital, but there is no other way to measure the point of something under neoliberalism. So that's kind of a really brief and really, really sketched out introduction to it. Okay, so the final takeaway I wanted to add was basically talking about what kind of economy is it. So instead of debating health versus economy, I'm debating what kind of economy are we talking about? Are we talking about one that grows at spectacular rates thanks to real estate, finance, but cannot ensure food to hungry people, nurses to sick people, and things like that? Or one which is poor by every measurable growth statistic, but ensures that most people will have food, water, shelter, dignity in a job, and a say in how things are made and distributed. I was also just re-upping the caveat that Kerala is not perfect, and it has a lot of problems, which I can talk about if people want to. But at the same time, there's not really any way to blur the boundary between 4 deaths and 100,000 deaths. And there's not really any way to talk about or to kind of equivocate between a place which doesn't have as much money and yet is able to produce basic equipment, and the richest country in the world, which runs out of a 75-cent face mask because of freedom, because of the freedom to pursue profit. And then I was just getting into the kind of key takeaways from all this. The first of which is public health means public, which means decommodified goods. The second takeaway is no place is too poor to produce and decommodify basic needs and to provide everyone with a decent standard of living. So the narrative of places need to develop or they need to build their economies or grow really doesn't stand up to the evidence from places like Kerala. A third key takeaway is that state capacity to mobilize people in production is essential during pandemics. So we need the garment factories to be put to work making masks. And this capacity comes from worker power, because when workers have power, they're able to, I don't know if people know about this GM strike. No, I think the GE strike story, which happened in the US, where workers were demanding that they make ventilators instead of whatever they were making. And that's the kind of state capacity that we need in a structural way, not just in an individual way. Another key takeaway, I think, especially for this being a union talk, is that worker organizing is key not only to command higher wages for ourselves, but also to demand a society oriented around health, education, social protections for all. I think that's a really important point. Finally, takeaway that I think is really important is democracy is a verb, it's a practice. It's an action plan that you make. People in Kerala understood this when they did not go home after they got their public health system, but they came out again and again to demand investments, implementation, expansion. They understood that rights are not given, they're taken. And this highlights the shortcomings of the rights discourse we sometimes see even in the US, where people say things like healthcare should be a right, not a privilege. That's fine and admirable, and yet not as clear as saying healthcare should be a public good, not a commodity, because that tells us exactly what we need to do and how we need to democratically agitate for a truly public healthcare system. Another takeaway, I think, really important for where we are now is that any place can have a true democracy if workers have power. So one thing I'm really committed to doing is de-exceptionalizing Kerala or other places which have achieved these successes. There's nothing inherent about this place that this had to happen this way. So scholars are showing that even in the US, there were moments when similar movements took place. So for example, in the US, people are talking about the New Deal now, which is being remembered as this moment when essential production was increased and unemployment was fought at the same time as a global crisis. That was the last time that happened successfully. And the New Deal in the US also arose out of the same post-Great Depression moment of crisis, as did Kerala's massive drive to unionization. Agricultural workers in Kerala were agitating at the same time as cowboys in Texas were going on strike and sharecroppers were organizing in the Jim Crow South in the US. Scholars actually tell us that in the 1920s, labor activism in America reached a zenith thanks to a militant working class, which especially after losing its front line in the flu pandemic of 1918, understood that demanding better working conditions and living conditions needed to happen, not just at a union to employer level, but at a state level. In a recent article, which is on the slide, mentioned on the slide, called The Long New Deal, scholars Raj Patel and Jim Goodman actually talk about how we misremember the New Deal. They say the New Deal today appears as a miracle, an incredible moment in which the nation stood united behind FDR and his Keynesian policies to accomplish big things. Such a reading is only possible because the New Deal's working class intellectual labor and the history of class conflict throughout the 1930s has been muted. The New Deal's victories were achieved not because the nation united behind them, but because the nation was profoundly divided. So what they're reminding us of is that these kinds of victories happened because of working class power, and they were undermined because of the fall in working class power, because of fissures in the working class coalition. Things could have been otherwise even here. So that's another key message. And then I just want to end by saying that the concept of the economy is something that really needs to be interrogated. It's a post-Great Depression, post-World War II way to frame things, which has really captured our imagination for far too long, and especially in the era of climate change, might not really be the best way to understand the world as it stands today. And if we decide we can have economies based on health and education, based on those things, rather than economies which grow only when well-being is sacrificed, or economies which just barely accommodate decent standards of living for the many. So the very meaning of economy can be recaptured. And instead of debating health versus economy, we can try to have the fight on the domain of what we mean by the economy. So I'll stop there, and happy to again address more questions, and sorry about the glitches.
Thanks, Aparna. That was really fantastic. And as union organizers fighting very hard for our first contract, this was really fascinating to hear about. We have some great questions in Q&A. Just encouraging everyone to please put your questions in now in the Q&A or in the chat itself. So I will start going through the queue. We have a question from Rachel Sandalo Ash, or two questions. What is union density in Kerala? And is bargaining conducted at the enterprise or sectoral level?
That is a great question. I mean, someone wrote great question, and yes, I agree with that. I don't know the figure of the union density off the top of my head. Again, these kinds of figures are pretty hard to come about in India, but I could look into it further to find that out. Bargaining is conducted at the sectoral level. So there are very large trade unions, but those trade unions have smaller components, smaller chapters. And yeah, so it's not individual enterprises bargaining with their particular employers. It's a sector level laws and sector level minimum wages and things like that. And that's true, I think, in many places. I mean, it's true throughout India and probably in other places too.
Great. All right, next question. Why do you think that ideas of reopening to help the economy or remain closed for public health safety has had such a polarizing effect? Why does it seem the divide has such distinct political overtones? This is from an anonymous attendee.
That's an interesting question. I mean, I think that has a lot to do with specifically the US political context right now, and the way that the US media and things like that have really divided people along these very rigid, very loyalist party lines. So that's not, I mean, for example, again, looking at a debate happening in the US and in India at the same time, there isn't a debate about reopening in India. It's almost worse because everybody agrees that we're reopening, and whoever dies, dies. And that's kind of what's happening. So I think that's like, it's hard for me to answer that because, yeah, I would have to know like what other way could it possibly have been framed in the US. And I think there was some efforts to frame it around like a workers' solidarity movement or a general strike and things like that. And then those kind of just fizzled out because there isn't organizational power of at the scale of the government or the media or the, I mean, for example, in Kerala, when unions are making demands and the newspapers are covering those demands in the local language and people are talking about them, they set the agenda for what is going to be discussed. And that's not who's setting the agenda in the US for what's going to be discussed. And I really think that's the key question. The question is of the media.
Great. Next question, another one from Sun Kayan. So this was going back to the first part of your presentation, the first COVID patient you were quoting from. As the patient mentioned, she was inspired by the public health system. Do you think people's trust in its government's health system have any direct impact on the spread of coronavirus in the said given country?
Yeah, I think so. I think that's really important. I mean, especially in the India versus Kerala context, like people don't trust the Indian government. People would rather just deal with coronavirus in their own homes, do the best they can, than turn themselves over to the government because God knows what kind of quarantine they're going to be put in. God knows when they'll be released. These are the kinds of things that have a very, very long history of mistrust that starts with the colonial government and it doesn't mend with the independent Indian government. So I think that's definitely true. And I think the way that governments have built trust in Kerala is by just being local. So the government official who is monitoring whether or not you're staying in your house, it's not some police officer, it's somebody you might have elected, it's some person you voted for, it's someone you actually meet, in local meetings. And there's local health workers who come to your house and they knock on your door, not to punish you for being sick, but to ask if you need groceries. So that's a completely different paradigm for what the government means. I think that definitely has impact on whether or not it spreads, because people will report if they're sick.
Right. Next question from Ege Humasak. Have there been discussions about surveillance and contact tracing in Kerala or other aspects of public health responses that raise ethical issues?
In terms of surveillance, so I mean, of course, contact tracing is surveillance, and there's no so insofar as there's ethical issues around surveillance, they exist around contact tracing, but it hasn't been the kind of big technology surveillance that we are familiar with when we say the word surveillance. It's been so there have been families, for example, who land in Kerala, and at the airport they're asked, who did you meet, where are you coming from, what did you see, and they don't answer, they don't want to, they don't think it's any of the government's business, and they go home. I mean, that's when you see that peak, on the curve. Once the curve has completely been flattened and then it kind of shoots back up again, it's because of one family. But I think that the way that that's dealt with is not punitive. People are not arrested for it. I mean, that's not been the response. I think because of that, the vast majority of people have cooperated. I mean, it really is. I mean, I wish I knew more about the negatives of the Kerala COVID story. It really is pretty unabashedly a success. Like 4 people have died so far. So I do think that they've done something right in terms of how they've tracked the patients. Even though there has been occasional mistrust and people who are wary of surveillance are everywhere. But yeah, I mean, if somebody else knows ethical issues, I'm happy to admit to them. It's really a very startling case.
Great, thank you. Okay, question from Vivek. What do you think are possible causes and factors for this heightened consciousness of the public good in Kerala vis-a-vis other states in India?
That's an amazing question. There's a huge literature on that subject. I think one of the key, so people trace this back. I mean, you can really keep going back in time to when it all began and why. But mostly people trace it back to the 19th century, when there was very powerful anti-caste movements. And what that means, I mean, I'll just kind of translate that to say that's not some religious thing. And I don't know how that translates in the American context, but anti-caste movements in the 19th century are basically on par with abolitionist movements amongst African American people in the US. So that's really what you're talking about, is a movement against a racialized system. And those movements, I think, really opened the door for unions to have presence even amongst lower caste communities, even though there always remains that tension. But for there to be unions even in agriculture, even amongst agricultural laborers, not just people who own farms. So I think that's really where it all begins, is with the history of, I mean, with race, basically, and with battles for battles for deracializing the working class to some extent, which were very successful in Kerala. And then, of course, one can always ask why was that successful there and not anywhere else? And then I would say that has to do with the impact of missionaries. And you can kind of just keep going backwards in time. So there's not really an ultimate reason that I can come up with. One way of kind of rethinking this question is like, why not? Why didn't the New Deal succeed in the US in doing what its counterpart had done in Kerala, for example, the labor movement was able to do? I think that's a really productive question and can tell us what to avoid and what to look out for.
Thanks, Aparna. That's super enlightening. Next question from Sheetal. What are your suggestions, relevant, what are your suggestions for how people in the US or in India can get a system that is more like Kerala's?
Join your union. I mean, that's really it, right? That's like the very, very simple message. Union density is everything. And there have been actually proposals. I mean, just people have written op-eds about this. I don't know if it's a serious proposal, but there have been proposals for having something like the Paris Agreement on climate, but for labor. which would basically rank and measure countries every single year based on union density. And if union density goes up, the country is succeeding. And there's an international deal that all countries sign on to saying we are going to increase union density. That's really what's needed. I mean, there needs to be a massive unionization drive, and it has to completely transcend sectors in the kind of traditional sense of like factory workers, or it has to be. I mean, that's another lesson from Kerala, right? Is that it's not just people in industry or people in cities who are unionized. It's agricultural laborers who are unionized. So I mean, this means like prison workers unions. This means gig economy unions. This means freelance people. Like this means everybody. This means tenants unions. This means things that, debtors unions, things that we don't think belong together, but they do belong together. And I would really recommend this Long New Deal piece on this subject, because they talk about what kinds of alliances need to be built. So I think that's really what needs to happen.
Great. I like that answer. A question from Henry. How is your definition of neoliberalism different from earlier forms of liberalism/capitalism?
Yeah, that's another great question. So I just want to, before I get into that, say that I think a lot of the times the debate around what's new about neoliberalism tends to become politically useless. So because like basically the only goal of kind of asking that is to say like, should we go back to what we had before? And I guess the answer just is no. Like there wasn't something amazing happening before that either. I mean, the New Deal had failed by the 1940s. So even though its after effects lasted for a while, the actual militancy of the working class was over. Union density was falling, number of strikes was falling. So I'll just say, why do we want to know that? That's just the first part of that. And then the second part is, yeah, there are lots of very small specific differences. So earlier forms of capitalism are about promoting exchange. That's like the thing that people are obsessed with, is like, let's just kind of bring everybody into a trade network. Whereas now what we have, at least ostensibly, is about promoting competition. So it's like, let's make sure that everybody, it's not about making sure that things change hands, but making sure that there's more and more and more enterprises. That's like every single person has our own like little thing, a website we set up where we're selling something. So that's really what it's about, is like everyone on YouTube is an enterprise because they're selling their talent, or they're selling their ability to capture attention. So I think that's a key thing about neoliberalism that's different. But again, when I think of as an organizer, think from a union point of view, like how does that help me do something about it? Because the answer just remains plain old unions. Maybe neoliberalism is something which is good to remind us that like we need to not think about unions in the factory sense. We need to think about unions again as unions of people who are in debt to the same bank. I think that's a really powerful idea, and I think that's possible today much more than it was in the 1930s. So insofar as neoliberalism helps us see like what to do, I think it's important to know the differences, but not really beyond that.
More questions about unions. So the next one's from Surya. So you mentioned the ability of Kerala to stage this response has to do with its history of strong and widespread unions. Are there any other regions of India that have comparable levels of union engagement? Given that Kerala's response is a product of its long history of union activism, how well and how do you think other places without such a strong history of unions can emulate Kerala?
Yeah, that's another great question. There are other places in India. I mean, it's very interesting because when you look at the Human Development Index in India, to a large extent, you can map it on union density. Like you can map it on places which have significant union presence as places which are the highest in terms of not income, but the index of just how long people live, how many infants die per 1,000 births, things like that, women's literacy. So those things have actually mapped onto union density. So there are other southern states in India which have had a long legacy of union struggle. There's even Western states like where Mumbai is, used to have a pretty storied history of unionization, which was then crushed. So a lot of the places in India followed similar trajectories to the US, basically broadly, and to, I think, the world at large. And the second part of the question, how do you think other places without such a strong history of unions? I mean, that's a really difficult question because, yeah, basically, I guess I'm just kind of saying, let's wait 100 years. I mean, not really wait, but like, let's kind of build unions for 100 years and then maybe we'll have healthcare. And of course, things have to happen now, right? Because the world is ending. Like, so that's a really hard question. I mean, I think one thing I would say is one thing that happened in Kerala is that they built on existing social movements. So when people showed up and started mobilizing for unions in the 1930s, they weren't like, oh, there's no unions here, so I guess we can't do it. They said, okay, what kinds of social movements already exist? And then they saw the anti-caste movements, and then they saw the movements for the right to education of lower caste people and the right to like different forms of dignity, like the right to wear shoes, the right to enter temples. And they said, you know what, that's kind of what we're going to pile on to. And then that's what they did, and building off of what exists. And I again want to just have a caveat here that there are huge problems with casteism in Kerala's left, which exist. But to the extent that the left was successful in the 20th century, it was only successful because of these coalitions that was able to make a cross-racial caste line. So I think that's probably what we can do, is just look at what's already there and start with that and build on it and make it about labor, move it towards issues of profit and distribution.
All right, anonymous attendee has an interesting question. Can you elaborate on why Kerala's unions came to prioritize fighting for public health and the public good, whereas many unions focus more narrowly on wages, benefits, etc.?
Yeah, that's a really interesting and important question too. I mean, one thing is like, in some ways, I guess those things were tied because health workers were unionized too. So the people who are in the best position to fight for public health are health workers. In this country, if people talk about Medicare for all, like there is nothing of that scale which has been achieved without a mass strike. And that's really what it requires. I think one part of the Kerala answer is that because of the completely intersectoral nature of unionization, that became much more possible. But in terms of why didn't they fight for narrow things like wages and benefits, they did do that. And to some extent, they ran into the limit of that because, when you fight for wages, wages rise. And when wages rise, companies move out of your state. That's what happens next. And because they don't want to pay you higher wages when they have super cheap wages in the rest of India. So they're just going to move next door. And when companies move, you lose your jobs. And then when you lose your jobs, you basically you're starving and you don't have anything. And all you have is the state's social security program. So that's what you're going to fight for. So to some extent, I think the public good has become the thing which is necessary to survive. And I think there was an understanding of like that the public's social safety net always has to be there in order for there to even be fights against capital, because otherwise companies flee and then you're left with nothing. But that is a really good question. I mean, that's the kind of question that's like circular, because like they fought because they were succeeding and they were succeeding because they fought. Hard to answer.
Thanks. Just to give everyone a sense, including Aparna, of where we're at right now, we have 8 open questions on the Q&A. Please, if you haven't asked a question yet, please feel free to ask in the Q&A. So next question is from Stu. Can you talk about the conflict, if any, between the national government and the Kerala government?
Oh yeah, there's it's a really an ongoing conflict all the time. I mean, right, just today, there has been like Twitter wars between Kerala's cabinet people, Kerala's health minister and Kerala's finance minister and the central government, because the government of India is now running these trains for migrant laborers. And these trains are, as I mentioned, completely unhygienic. They're taking like 3 days to arrive to their destination. People are in there without food and water. They're crowded, they're packed in there. And then these trains are kind of returning to Kerala now, and the state has not been warned that people are going to be returned to it. So they're not able to do their contact tracing and their testing and their, basically like mapping who's coming into the state, which is a huge public health hazard. So it's very difficult to be a very radical state in a very conservative country, and the battles are ongoing. And to be honest, Kerala can't win like alone if unless there's a kind of movement of labor across India. I mean, health spending has been going down in Kerala for the past 30, 40 years. Education spending going down in Kerala. Strikes have been going down. The government is involved in just paying huge debts to the Indian government and to the Asian Development Bank and the World Bank, and all of these different entities are insisting that Kerala cut its public budgets, cut its its government staff, and workers are resisting this. But there's a conflict just in terms of little Twitter battles and like little kind of statements and things like that. But there's a huge conflict, structural, which I think, yeah, is undermining the Kerala model slowly.
Right, thank you. Next question is from Lauren. Is public education also better in Kerala? I think part of the problem in the US is that people have a poor understanding of health and science. They don't understand the point of wearing a mask and how that will stop the spread of the virus, and just see it as a political issue.
Yeah, public education is much better in Kerala than in lots of parts. I mean, I don't know how to compare it to the US in terms of the content, but in terms of how many people are educated, it's definitely far superior to the developing world at large. Women are overwhelmingly educated in Kerala. They're more educated than men. They live longer than men. And I think all those factors help. But I think part of what helps too is that because of the focus on education, again, as a public good, the educational system isn't exclusively focused on just churning out people who can quickly become part of the tech industry or things like that. Instead, Kerala actually overproduces nurses and exports them. I mean, they go all over the place. Actually, a big part of the UK's nursing workforce is from Kerala. So that's a really important, I mean, I think that education is super important and it's up there. But also just the focus on translating things to the local language, presenting things with kind of local cultural workers, going into different villages and doing a play on how you need to wear a mask. Those kinds of things are super important for people who are not literate or who are not educated. So I think all that matters. Yeah.
Great, thank you. Next question is from Jane, who I think has the same question as me. What references would you recommend to someone like me suddenly interested in learning more about Kerala's union history? Also, can you speak a little bit more about your current research and how that informs your approach here? And a note from her. This is a brilliant presentation. I can't wait for the recording to be made available so I can recommend it widely. Thank you, thank you, thank you.
Well, thank you so much. What would I recommend? I mean, the funny part is like I don't work on Kerala. I work against Kerala. So I actually work on really kind of the opposite of Kerala in India. Is a state called Rajasthan, and it's basically one of the like least developed states in terms of just all these social indicators. And my research is focused there on these huge World Bank loans, which are given to the state to develop, and all of it does these perverse things of reducing health budgets and reducing educational budgets and increasing, how much in debt people are, and then measuring development based on how much debt people are holding as a way of measuring how entrepreneurial they're becoming. So I work in this kind of really perverted context, and I really need hope. And I think Kerala provides that for me, and just the contrasts are really mind blowing. So I myself am just learning about it, and I think I'm coming at this from someone who's basically a scholar of India, just foraying into Kerala. But in terms of what you can read, there is this really good, I'm just going to recommend an article, and there's this really good book review, if you can get your hands on it. It's by Vijay Prashad, who's an amazing public intellectual, and it's called The Small Voice of Socialism, and it reviews 3 books which are on Kerala. And I found it like through Harvard's library, but I think that a lot of the resources are becoming free for the public, so it should be available via JSTOR, or I'm happy to send it to you if you email me. But I think that's a great start because it reviews these 3 books, tells us what the debates are. So I guess I would start there, and thank you so much for your kind words.
Thanks, Aparna. We could send it out in our email with the recording too.
Awesome, yeah.
Next question from anonymous attendee. How is it dealt with when people contribute to increases in cases in Kerala by people landing and not reporting contacts, etc.?
They insist that you just report them basically. So they send health workers over. So there was this couple who landed from Venice. And by this point, Kerala had already, so they have had multiple waves of coronavirus. The first wave came from Wuhan. They completely crushed it. Then it came from Venice. And there was this couple who landed and they refused to say what they were doing or where they came from. And they just kind of ran away, went home. And then once people realized that they might have been the spreaders, health workers went to their house, they were brought in to isolation, and they were just repeatedly asked, like, you have to tell us who you interacted with, like there's gaps in your story of who you met and who you talked to. I don't think there was any punitive action in terms of being arrested, although I will say that Kerala's pretty quick about arresting people if they spread rumors about the virus. So things like drinking cow urine in India will get you landed in jail, and they're pretty unapologetic, which is like, this is a public health crisis. So yeah, in terms of police deployment, I don't think that that's really happening, or that's not what they're doing, but they do insist, and because it's local workers, they just like come to your house every day and they call you all the time. So in that way, I guess it is surveillance of a very annoying nature. It's like your neighbors show up all the time.
Thank you. Next question, going back to unions from Syria. The disadvantage of a union culture is that it disrupts industries, since there are strikes almost on a daily basis. How do you reconcile this with your suggestion that a union culture should be promoted?
Yeah, that's the big problem, right? And is that, I mean, Kerala did have strikes on a daily basis, and industry, at least this was how industry felt about the whole thing, is that they felt that the state is a huge problem, and if we put our money there, it's just going to sink. All these workers are just going to constantly agitate. Nothing will get done, et cetera, et cetera. And then they moved out. The solution to that, I guess, I mean, it just depends on like whose problem are you trying to solve? Are you trying to solve the union's problem that the factory is leaving with all the jobs? Are you trying to solve the factory's problem that's not making any money? If it's the latter, don't try to solve that problem. Like, it doesn't matter that they make billions of dollars or rupees in profits. But if it's the former, if the problem is that there's unemployment, if Kerala were a country, it could actually have things like an exit tax. So if you're trying to flee from Kerala and you have lots of money and employing a certain number of people, you're going to have to pay into the state coffer because you made that money here. So that's one solution. Another thing that the government of Kerala has actually done is set up cooperatives. So for the industries which flee, for example, cashew is an industry which like fled Kerala because of union activity. The government funded workers to set up their own cashew cooperative in which all the workers own it together, and then they tried to produce. And that didn't also succeed because it was undercut by people who were producing without paying good wages. And so that's really the ultimate dilemma, is that as long as the market is operating somewhere with cheap wages everywhere are going to get cut. And the only way to fight that is by using working class power to agitate and tell the government to prevent or to like decommodify more things, so that people are able to pay fair wages, and that there's able to be strikes. So I think that's the way maybe to solve the problem: exit taxes, further decommodifications.
Great, thank you. Next question, I think, is actually on a bit of a related topic from Renato. Not discounting the many regional mutual aid efforts and organizations peppering the US right now, I imagine if something like what's happening in Kerala were to happen on a large scale in the US, i.e. in a way large enough to threaten the profits of big business in a large area, there would be an effort to crush it. Given that the rich have a stranglehold on the government in India, just like in every other country, how has Kerala been able to flourish and succeed like it has without being put down?
Yeah, that's a really good question. I mean, it has been put down in a really significant way, because what they were asking for was way more than what they got. But so, for example, in 1957, Kerala became a state. That's when they kind of first attained statehood. a communist government came to power as soon as they attained statehood. In 2 years, India dismissed the communist government. Like, just the prime minister was just like, "You're no more government. Like, be gone." And then it took 2 more decades for them to come back to power. So there has been, and then there has been violent efforts to stop these communist parties and left parties as well. There's disappearances, murders, you name it. Like what we've seen in Latin America and other places has happened also in Kerala. That being said, and that's happening to this day, and it's succeeding really horrifyingly. But that being said, I guess once you have a generation or two of workers who have made these demands successfully and have experienced what it's like to have public health and public education and have unemployment benefits, and it's harder to take things away, right? Like, than to never have given them. I mean, that's the same in the US, is that it's much harder to fight for and win something like the Green New Deal or Medicare for All, which have never existed. It's easier to fight to defend the postal service or to fight to defend Social Security. Like those things exist and people don't want to lose them. That's unpopular. So I mean, again, that's like a circular answer, because like once it's there, it's there. But I think the way that Kerala is able to achieve it is just the sheer number of people. Like, you just can't crush that many people. I mean, we outnumber workers, outnumber everybody else. And I think that they really mobilized all of them. They mobilized a significant portion and made it very difficult to put it down, but that's somehow still happening.
All right, thank you. Next question, speaking of communism. An anonymous attendee is asking, communist governments are notoriously known to suppress numbers of deaths. How are we certain about Kerala's statistics?
Kerala is, I guess, or is seen as, I mean, there's a reason that the article I just mentioned is called The Small Voice of Socialism, in that Kerala never had, it's not one of those post-revolutionary communist governments where you have these long histories of violence, political violence, imprisonments, which is true, right? I mean, to some extent it's propaganda, but to some extent that's true of places like China, Venezuela, Cuba. I mean, all these places come in that list, and Kerala is very, very much the exception to that. That's why it's been of interest to people interested in unions and the left for a really long time. So I guess they've just been extremely transparent. I mean, they have daily briefings. There's no other independent data which has contradicted what they've done. And they frequently allow researchers from the UN, from different international organizations to come and survey. And most of the data that they produce is collaboratively produced with academics. And I mean, it's just been a very transparent government for a really long time. So one should always have some doubt, but there's not really any reason they're given to be doubtful.
Okay, thank you. Next question, also from an anonymous attendee. You emphasize the importance of decentralized planning. Can you talk more about that? What does that mean, and how is it implemented in Kerala? How is it different from what a centrally planned approach would have looked like over there?
Yeah, that's a great question too. Decentralized planning is something very new in Kerala. It's only since the 1990s that the government has tried to do that. And what that's meant is basically, it's very, basically what you need to form little committees at every single level. And then at the very bottom is a committee, which is all the members of that village, all of whom show up and talk about, what do we want here? Do we need a well? Do we need place for people to a hostel for teachers to live? What is it that's needed? And then that data is collected, and then there's a kind of seminar where academics and experts come and they talk about the feasibility of all that. Can that be done? Do we have the resources to do that? What do we need to do this? And then that goes to a higher level, and it kind of collects, and then ultimately there's a state level plan that's released, which is not like a strict, like a thing that guides production and kind of overrides everything else. I mean, of course, if I want to go and set up a shoe factory in Kerala, they're not going to tell me that's not on the plan and you can't do it. So in that sense, it's not really a planned economy, because that doesn't exist. But in terms of what the state's going to spend its money on, India is really notoriously famous for the government spending money on making large statues, making huge monuments, making These kinds of things when people are dying of COVID. I mean, right now there's a plan to refurbish the Parliament building at massive cost, and it was supposed to be done this year. And I think it's still going to happen. I mean, I think it's been postponed because of the optics. But that kind of expenditure, what the government spends on development and discretionary expenditures, that becomes constrained by local planning. So I think that's really just a very basic first step. And a lot more could be done. But so it's not really a planned economy in the sense of the Soviet Union or India or these kinds of places used to be. It's just a kind of constraint on what the government should be able to do.
Great, thank you. Looks like we're down to our last two questions. Vivek asks, you cited the history of anti-caste movements as instrumental in creating a public good consciousness in Kerala. To transpose this onto the American context, would a good way to engender a public good consciousness in the US be to organize around anti-racist gold and build around those successes?
Yeah, absolutely. I think this is again, I think maybe the New Deal article, we should send that as well, because I think that's like anybody who's alive right now needs to read that because it's so important the moment it talks about. And it basically talks about what happened that brought down the New Deal coalition in this country. And they basically say it's Democrats' reliance on racist Southern lawmakers. They couldn't do without those people. And yet because of that, they couldn't join sharecroppers in their struggle. They couldn't, start opposing Jim Crow. They couldn't, and it's not that they couldn't, they didn't, that it went against their interest at the moment. And there wasn't pressure on them to be able to fight it. And the racial line undermined the whole thing eventually. So yes, absolutely. I think that's crucial. And I don't think that's just like, we need to add identity into the labor mix just so that it blends nicely or something. But it's just the simple, even economic fact that as long as somebody's working for free, nobody's going to raise some people's wages over here. Like they're always going to go find that free labor. If I'm producing sanitizer and I can either pay this unionized labor force, white labor force, or I can go to prisons and get it made for free or for like 2 cents, I'm going to do that. So as long as there's unfreedom somewhere, in whichever racialized minority, there's not going to be some kind of labor justice for anybody, not in some ultimate sense. So that's absolutely the thing. It's racial justice where it begins.
Thank you. All right, I guess we're at our last question. Thanks everyone who's still here. Thank you, Aparna, for sticking around to answer all of these great questions. So Renato asked, can you talk a little bit more about the role that ostensibly benign organizations like the World Bank and the ADB, Asian Development Bank, play in developing the neoliberal world order, how that manifests in India?
Absolutely. Yeah, that's a really important question. If it was not about India and about most parts of the world, I would say that organizations like the World Bank have basically got a lot of developing countries in debt bondage. So they've basically made these loans, and third world and developing countries are not able to pay it back with interest. Even though if you look at it, they've actually paid back the original amount about 8 times. But they still need to pay it back 4 more times because of how compound interest works over the years and because of adjusting interest rates. But basically, the World Bank and the IMF made these massive loans throughout the 1980s, and they gave these loans with conditions that you're going to repay these loans to us every single year by cutting your education budget, your healthcare budget. You're going to cut the number of people who staff your if you have you're going to, first of all, you're going to privatize energy, privatize water supply, privatize electric company, internet, whatever you have, privatize that, and then cut the number of government workers. So these were the demands that were made by these organizations, which led to just massive impoverishment in lots of countries. And Kerala was actually part of this whole mix because Kerala was forced to borrow from the World Bank and things like that. That being said, I just want to mention that India doesn't really fit into the story neatly because in India, there was always a huge group of kind of industrialists who were always waiting for this kind of opportunity, for this kind of loan to arrive, and for there to be an excuse to cut everything. And those folks were waiting, and it came. And so it's just like the deficit hawks we have here. who are not, it's not a real pressure. It's just a thing that they've been sitting around being like, who's gonna give us the opportunity? Is it China? Like, what are we gonna say? Who are we gonna say we're in debt to so we can cut Social Security or the Postal Service or whatever? So in the case of India, I think things are different. And I think India is actually part of that whole like World Bank, Asian development, and IMF, that whole nexus. But the states of India are not. And so they're suffering. And there's this kind of reverse colonialism inside of India from the center to the states. But there's an amazing book called The Divide. I can write that in the email too. I think everybody should read that if you're thinking about global justice and World Bank and what the World Bank does, actually, what it means. It's like a super readable 2017 book by an anthropologist. So.
Great, thank you, Aparna. That was our last question. Thanks so much for such an enlightening presentation and for the marathon Q&A. Thanks to everyone for your really great and insightful questions as well. Looks like we have a little bit of a reading list we can send around to everyone. Looking forward to seeing that. Yeah, anything else you want to add?
No, just thank you so much. I see that there's like 40 people still here. Oh my God, thank you so much. Hope you're all staying safe and as well as you can. And yeah, I would love to hear from you. If you look me up, email me if there's further things we can chat about. I would love to see how we can all work together and organize together.
Mark and Camille, anything you want to add?
No, this was so wonderful. Thank you, Aparna.
Yeah, this was great. Thank you. And thanks for all the questions. That was really great.
Thank you.
There's something in the Q&A right now. Is that? Oh, it's a thank you from Rachel.
Thank you, Rachel.
Yeah. Yeah, thanks again to everyone.
Reunion.
Yeah. Organize your workplace or your apartment building. And yeah, so we have one more talk for this round of night school. It's actually a roundtable presentation with all 6 of our wonderful presenters today, including Aparna. It's going to be interdisciplinary. I think it'll be an interesting change of pace from the previous 6 talks. Those of you who haven't signed up yet, I'm gonna type the sign up link into the chat so you get the Zoom link. Yeah, so more thank yous in the Q&A. Can't wait to organize for the Detroit Agreement. This is the labor Paris.
Okay, yeah, I didn't know the name. Yeah, that's awesome.
I don't know if that's a real thing or just a aspirational. Yeah. Great. Well, I think it's 9:41. Might be time for us to turn in.
Yeah, thanks again. I guess we'll hopefully see everyone next week.
Yep, sounds good. Hope to see all of you for the last currently scheduled night school talk next Wednesday, 8 p.m.
Take care.